Around 20% of people still have knee pain 1 year following total knee replacement. It can be incredibly frustrating to go through a surgery and a prolonged and often painful rehabilitation process, only to have your knee feel no better or possibly even worse than it did before surgery. I'm Dr. Dave Candy, a physical therapist specializing in chronic pain, and in this video, I'll explain some of the most common reasons why people have persistent pain following knee replacement, plus some practical tips that you can use to improve your knee comfort and quality of life. So let's dive in. When patients still have pain 6 months or a year following surgery, they start worrying that something has gone wrong with the surgery. Is the component put in wrong? Is your body rejecting it? Is there an infection? And the good news is, in most cases, that isn't the case. It can happen, but what's really frustrating is when you go in to see your surgeon and they say, yes, everything's exactly where it should be, everything looks wonderful, it's fine, but you don't feel fine. You still feel like something's wrong. And you can't help but wonder, is there something they're not telling me? Is there something they don't know? Is something wrong that I'm not going to recover from this and that I'm going to be one of those horror stories that you hear about? Well, there's actually a lot of research on the topic of persistent pain following knee replacement. And one of the most thorough studies is a meta-analysis from back in 2015. Now, at the time of recording this, that is almost a decade old. But the findings really haven't changed that much in newer subsequent research. So this study was a meta-analysis where they combined results of 32 different studies on the topic of chronic pain following knee replacement, and they had data on almost 30,000 patients in this study. Now, with a study of that size, findings tend to not happen by coincidence, and they found 5 main predictors of chronic pain following knee replacement. And those findings were catastrophizing, poor mental health, high preoperative pain, pain at other sites, and number of comorbidities. Now, when you look at the data table, you'll see the p-values, and that's the probability that these things could have happened by chance. But with a large study like this, you'll see a lot of the p-values are less than 0.1%. So it's very unlikely that these findings occur by chance. The effect size is how big of an effect it has. And you'll see that catastrophizing by far has the biggest effect. So catastrophizing basically means high negativity, thinking things like, well, bad things always happen to me, I'm going to be one of those horror stories. And chances are, if you think that may happen, there's a higher likelihood that it actually could happen. So having a good mental outlook and believing that the best is going to happen and can still happen, even if you've been suffering for a year or more after surgery, is one good way to help improve your situation. Now, let's look at some of the other factors. What about poor mental health? That includes things like anxiety or depression, which have been shown to be predictors of persistent knee pain following knee replacement, but they're also, in general, poor prognostic indicators for most health conditions. And if you take someone who's anxious or depressed and someone who's not, generally the person who's not has better outcomes because they may have the same physical outcome, but the person who's anxious or depressed may be less happy or satisfied with it. And given that the physical outcome of the knee replacement isn't necessarily what defines success, sometimes it comes down to expectations. When you have a pre-surgical expectation of what you hope to achieve, and then the post-surgical outcome doesn't necessarily match with that, that's when people are unhappy and unsatisfied. So we'll get into some tips to help with expectation matching and how to move forward if you do have persistent pain 1 year or more following knee replacement. But let's first look at some of the other factors. What about high pre-surgical levels of pain? Now, you would think that if you have high pre-surgical levels of pain, that would be a very good reason to have the knee replacement. But that tends not to be the case. With most statistical outcomes, the baseline level of anything tends to correlate pretty well with the end result. So if you have lower pain levels to begin with, chances are you'll probably have lower pain levels at the end. Some of that has to do with the sensitivity of the nervous system, that some people tend to transmit signals to their brain a little bit faster. It can be related to other things like anxiety and depression. For example, your brain processes how much of a threat value something is, and the more threat value that's perceived, the higher your levels of pain will be. It can also have to do with things that are not caused by joint pain. That if you have muscle pain or nerve pain, then if you have a surgery to replace the joint and the pain was coming from somewhere else, then you can continue to have high levels of pain afterwards because the painful tissue wasn't replaced and it was aggravated by the surgery. Now, similarly, people who have widespread pain or pain in other areas, for example, people who have pain in both knees or who have had both knees replaced, or people who have had both knees and both shoulders replaced. When you have pain in multiple areas, that tends to indicate more of a central cause of pain, that the nervous system is a little bit more irritable. And when the nervous system is irritable, replacing individual joints doesn't necessarily help when it's compounded on top of a nervous system that is a little bit more excitable and tends to send danger signals to your brain a little bit more regularly. So again, regulating the nervous system irritability is another thing that will help to bring the pain levels down and help get you feeling better. And then finally, what about comorbidities? These would be things like diabetes, obesity, high blood pressure, and actually individual comorbidities don't tend to correlate very highly with outcomes, but the more of them that you have stacked up on top of one another, the higher the likelihood of a poor outcome. And so improving your overall health with general wellness tips, eating well, getting enough rest, getting enough aerobic exercise, those things will help improve your heart function, they'll help improve your blood sugar, they'll help improve your stress, and so they tend to bring your overall health status up, which does actually tend to decrease your knee pain. Now, I mentioned that study was from 2015, but a more recent study in 2023 had fairly similar findings. This study was a meta-analysis of 30 different studies with data from 26,517 patients. And they studied 151 different things that potentially could have affected outcome. But what they found is that the things that most affected outcome were, again, pain catastrophizing. Younger age was also a factor, which most people think that the older you are, the worse your prognosis is for recovery. And older age does tend to make you more likely to have comorbidities or to potentially die on the table. But if you get past that, people who are of older age tend to have more severe arthritis, which means that if you replace the joint, they're more likely to have a better outcome than, say, someone who's in their 50s and may have knee arthritis that wasn't quite so severe to begin with, and that the pain was coming from another place. Similarly to the other study, both high preoperative pain levels and high immediate postoperative pain levels tended to correlate with higher pain levels in the long term. And females were also at a higher risk for chronic pain following knee replacement than were males. It should be noted that there was also high to moderate certainty that there was no association between preoperative range of motion, body mass index, having one or both knees replaced, or the American Society of Anesthesiologists score. So given these findings, what do you do if you still have persistent knee pain 1 year following surgery? Well, if you've been following along, you can probably guess that there's no one specific stretch or exercise that's going to fix the problem. You do have to determine what are the factors that are contributing to the persistent pain, because pain is a biopsychosocial phenomenon. It has to do with some of the physical things, which is no longer joint pain, and if you don't have an infection, it's most likely soft tissues and nerves that you're dealing with. If there are restrictions in your range of motion from stiff muscles or stiff joint capsule, I'll put some links to videos with tips on how to relieve stiffness around your knee, how to improve your straightening, how to improve your bending, and how to walk without a limp. I'll include those in a playlist and also in the description down below. But you also have to consider general health. Again, eating a healthy diet, getting enough sleep, getting enough aerobic exercise, whether that's walking or whether that's doing something like riding an exercise bike or exercising in a pool where you have a little less weight bearing on your knee. All of those things help to control stress, control anxiety, help improve blood flow, help decrease diabetes and high blood sugar. They help decrease weight, which helps put less pressure on your knee and require your muscles to work less hard. So good general health practices are another thing that will help you decrease chronic pain following a knee replacement. Now, since catastrophizing and mental health status were some of the most common predictors of persistent pain following a knee replacement, it would be remiss of me not to mention those, even though those are things that people don't really like to think about. Now, I'm not saying you're making the pain up or that it's all in your head. In fact, I've written a book called Chronic Pain, You're Not Just Getting Older, You're Not Crazy, and It's Not All in Your Head. And one of the things that I mention in this book is the nature of chronic pain and how it's different from acute pain. Acute pain tends to directly correlate with the amount of stress or tension or injury to your tissues, whereas chronic pain has more to do with the threat status of the situation. And in fact, that's what pain is to begin with. It's not a signal that your body sends your brain. It's really your brain's response to that signal in combination with your past experience with pain, how long the pain has been going on, other physical factors that may be going on in your body, such as comorbidities, your stress levels, and other things that may be not so great in your life right now. Those all kind of conglomerate to affect your pain levels. And so if you do have other stressors in your life, that can affect how bad you feel your pain. So I want you to think for a moment about what your ideal life would be. What would be your absolute ideal outcome if you woke up tomorrow, all your knee pain was gone, and everything in your life was just exactly the way you want it? Think about for a minute what that life would look like. Go ahead and take a minute and write that down on one side of a piece of paper. You can pause the video if you need to, but really take some time to do this exercise as to what the ideal perfect life would look like for you. Now, after you've done that, on the other side of the piece of paper, write down what's different from that life currently. How is the ideal different from the current situation? And don't take into account just your knee pain, take into account everything. Typically, that falls in three categories: health, wealth, and relationships. So things related to your physical health, both your knee and other things related to jobs, money, bill stress, financial stress. Those can all relate to your stress levels and pain levels. And then how happy you are in your relationships. If you have a good support system to help you recover. And then find the one of the things on that list that is the biggest discrepancy, the thing that's causing you the most dissatisfaction right at this current moment. That could be related to your knee. That could be related to something else. But then pick that one thing that's keeping you from being the most happy and most satisfied with your life right now, and then focus on improving that one thing. And that may mean not focusing so much on your knee, but focusing on some other factor. Or maybe it is focusing on your knee. But I would caution you that if the biggest factor in your life right now is that my knee hurts, then dig a little bit deeper and think, well, what's good about my knee feeling better? If my knee were to feel better, what would I be able to do differently? How would that affect my day-to-day life? Would it mean that I feel safer in my house, that I can go up and down stairs more comfortably? Would it mean that I can go out and enjoy vacations, go on a cruise and do the excursions? Would it mean I can play with my grandchildren? Find that deeper emotional meaning that's driving you to want your knee pain to go away. And then focus on improving that thing. Take your cruise. Spend time with your family. Do the things that are bringing satisfaction to your life and still continue to focus on your knee pain, but don't make it the outcome on its own. Because if your number one goal is I need to put everything on hold right now until I get my knee better and then my life can continue, chances are that you may not get to that point. But by focusing on the things that you want to happen in the end, getting a better quality of life, doing the things you enjoy, doing things that bring value to your life, you'll probably start to notice that your knee pain starts to go away. Now, if you need some more tips to help with chronic pain, you can pick up a copy of my book on Amazon. I've also got a playlist over here with some other tips to help following knee replacement. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.